Considerations for Effective Operation and Implementation of Significant Health by Kelly Hawk, Instructor Dr. Vikraman Bhaskaran, Informatics 675. The implementation of health information technology interventions is at the forefront of most policy agendas worldwide. However, such undertakings are often far from straightforward as they require complex strategic planning accompanying the system organizational challenges associated with EHR programs. By initiating research upon the experiences of EHR platforms, my hope is informing the ongoing international efforts of policymakers, health directorates, healthcare management, and senior clinicians to help build this amazing system to improve for the better. In this study, I will research the experience and various encounters with healthcare technology, with the scope of experiences of different work encounters with EHR data systems frameworks to help give key indicators that streamline execution efforts. I plan toward an advice strategy and training advancement to help develop a more effective combination of an innovation into intricate medicinal services conditions. Large-scale, potentially transformative implementations of health information technology are now being planned and undertaken in multiple countries. The hope is that the very substantial financial, human, and organizational investments being made in electronic health records, electronic prescribing, whole system telehealth care, and related technologies will streamline individual and organizational work processes and thereby improve the quality, safety, and efficiency of care. The reality is, however, that these technologies may prove frustrating for frontline clinicians and organizations as the systems may not fit their usual workflows and the anticipated individual and organizational benefits take time to materialize. Factors affiliated with ensuring I implement a successful informatic research complies with social. I must take into consideration attitudes and concerns, resistance and workarounds, expectations, benefits, values and motivations, engagement, user put in design, training and support, and integration with existing work practices. The technical aspect, I must consider the usability, system performance, integration and interoperability, stability and reliability, adaptability and flexibility, somewhat cost, accessibility and adaptability of hardware, organizational, getting the organization ready for change, planning, leadership and management, realistic expectations, teamwork and communication, learning and evaluation. On the social political side, other healthcare organizations, industry, policy, professional groups, independent bodies, the wider economic environment, and possibly in the near future, even international developments. Once the need for a change was established, it was important that I committed adequate time and resources to thoroughly consider different options in terms of which research method to choose. I have found that this aspect of planning and the associated writing of business cases and procurement considerations are sometimes underestimated and often rushed. Among the different methods of data gathering for research purposes, the survey method is preferred by many researchers due to its various advantages, strengths, and benefits. I had to keep in mind how important it is to be aware of the full range of system providers and network with potential suppliers in order to understand the ethos and values of the companies with which Emory may consider embarking. Since I have experience in the call center, my questions will not be off of assumption. My detailed survey will help get to the underlining of what the system is lacking. Since the call center is the first line of contact and it is a very fast-paced environment, The call center agents will be able to give functional feedback from my survey of what they encounter on a daily basis. Many health information technology procurements are based on assumed benefits, which are often poorly specified. This can result in difficulties agreeing on a shared vision across the healthcare organization. While terms like improved quality of care and improved efficiency are often used, detailed outcomes resulting from specific functionality are hard to measure and to anticipate, as much implementations require fundamental changes to operational processes, and many organizations do not even attempt this. Professional, managerial, administrative, and clinical consensus must be considered in order to build my strategic vision, in addition to creating the means to support the realization of this vision. This involves considering whether to aim for radical changes across the organization or through implementing training electronic health record functionality, or whether to focus on streamlining specific processes, electronic prescribing initially, and then expanding functionality over time. Many researchers in the field of organizational change have highlighted that high-level strategic leadership of senior management, including both administrative and clinical leaders, is vital, but it is essential that I involve doctors, nurses, administrative staff, and managers in order to facilitate what they will benefit from this research later. Careful planning and ongoing critical evaluation of progress are essential to the successful workflow of health information technology. Taking a life cycle perspective on the evolution of technological systems will help organizations to avoid some of the all too commonly encountered pitfalls and improve the likelihood of successful implementations and adoptions in the future. It is, however, important to keep in mind that although the stages and considerations I discussed here were depicted in a linear manner, this is consistent with the complex nature of large-scale health information technology organizations where a range of different interrelated factors are at play.